Are you suffering from repeated stomach pain? Why is it not going away? Find out the hidden truth behind stomach pain that continues to bother you. Stomach pain is your body's way of shouting that something is wrong with you. The longer you keep ignoring, the louder it gets. But remember, sometimes it can be too late. Watch this video until the end to find out all about stomach pain. Please do not forget to subscribe to watch more such informative videos. I am Dr. Yoganand Reddy. I am a UK trained gastroenterologist. Stomach pain is something so common that in our lifetime pretty much everyone experiences. Sometimes it is just overindulgence of food. We can put it down to food poisoning, something we have eaten wrong, something we may have eaten heavy or overindulged, like in the parties, sometimes combined with alcohol. This can happen to anyone. It settles down. Most of the times it's a minor issue. But if it is happening repetitively, so pain that keeps getting worse, or if you're noticing too frequently, it can indicate there is a problem, because it's not normal to get stomach pain daily or frequently. Let us look into what might be causing your stomach pain. Sometimes ignoring problems can make the problems worse. Simply treating with over-the-counter antacids, gastric medicines, home remedies, and taking all kinds of advices from YouTube and Google from non-qualified people, so non-gastroenterologists, will end up with issues where you might be actually mistreating chronic conditions. Delayed medical attention certainly can cause problems. Many people self-diagnose stomach pain as gas, and most of the times, yes, these are simple things that go away. But there are other reasons for somebody to be having stomach pain frequently, although it might seem very simple. But it could be an emergency also, sometimes like appendicitis. It could be stones in the gallbladder that cause severe abdominal pain, sometimes can go through to the back. It can be swelling in the pancreas, pancreatitis, that starts in the abdomen and gradually can get worse into the back, and sometimes it can present as chronic abdominal pain, so dull pain that keeps on coming. So ignoring or misreading these early symptoms can give the actual condition, what's inside, to worsen, and it can progress to a different stage. Secondly, stress. Remember, stress is not just in our brain. Stress affects the gut, what we call as the brain-gut axis. So any kind of anxiety, stress, poor sleep, depression, all these things can slow down your digestion, increase the amount of acid in the stomach. It can provoke inflammation in your gut. It can definitely worsen symptoms of IBS, ulcers, acidity. Thirdly, your stomach might be hurting. That's because it's not the actual problem in the stomach, but the brain is overwhelmed with whatever is going on there, overthinking, anxiety. So this connection between the brain and the gut, it's not just emotional, it's a physical connection. You might be allergic to certain foods. So if you're eating the wrong food, some people get stomach pain because they are exposed to foods that your body is not accepting. You might not feel it immediately. For example, let us take a gluten allergy. Gluten is a protein that is predominantly in wheat, also in rye and barley. So if you got intolerance, genuine intolerance to gluten, what we call a celiac disease, the moment the gluten goes into your small intestine, it causes irritation, damage to your intestines, causing pain, irritation, bloating, nutritional deficiencies. You might also be allergic to milk, lactose intolerance. Lactose is a natural sugar. So undigested lactose, because you have deficiency of lactase enzyme, gets into your gut, can cause repeated abdominal pain, gas, diarrhea. So you might be intolerant to certain foods that have fermentable sugars. For example, let us take common foods, onions, garlic, peas, beans. These what we call as FODMAP foods, which can cause a lot of bloating and cramping abdominal pain. You might be slowly poisoning your gut with the wrong food without even realizing it. The other thing nowadays, commonly people self-medicating, simply taking painkillers for minor things, simple headaches, body pain, and for stomach pain itself. So they're taking painkillers without even knowing that these medicines can in fact damage their stomach lining as well as their kidneys. So these medicines themselves can cause ulcers because, for example, these anti-inflammatories, what we call as non-steroidals, they can damage the mucus layer, the covering, the lining of the stomach. Various antibiotics, people are just using it left, right and center, can also cause damage to the gut. So the medicines, what you might be thinking is giving you relief of the pain, they themselves without your knowledge can be the cause of your pain, and in the long term can make things worse for you. You might have infections that you might not even know about, like this H. pylori, Helicobacter, that sits in the stomach lining for months to years without even you realizing. Of course, in our country, there is various worm infections, parasite infections. These symptoms sometimes can go on for months to years. You might be suffering from an inflammatory bowel condition, what we call as ulcerative colitis, Crohn's disease. So in these conditions, there is swelling, there is inflammation, there is ulcers in the intestine. This is different from IBS because IBD is there is disease in the gut, so there is inflammation. This inflammation can cause repeated damage to the gut and it can cause narrowing of the intestine, resulting in pain. And this is a condition where your own immune system is attacking your gut. So this chronic pain could be a result of this kind of inflammatory conditions. And the last one, which is not the one which anybody wants, is cancer. Although it is not common, gastric cancers, colon cancers, pancreatic cancers can begin sometimes with mild symptoms that gets often mistaken for simple gas issues. If you are noticing worsening pain, so the pain that is not settling, pain that is waking you up in the night, feeling full, if you're losing weight, if you're starting to vomit frequently, if you're noticing persistently change in the bowel habit with worsening constipation or worsening diarrhea, these symptoms you should not ignore, especially if they're associated with abdominal pain. The stomach cancer itself is a silent killer because in the early stages, the symptoms people dismiss thinking it's some simple gastric issue. I've got some acidity, I've got some gas issue, I've eaten the wrong food. But in reality, there might be a cancer that is sitting in the stomach which is slowly growing and can present at an advanced stage. So do not ignore if you're suffering with repetitive attacks of stomach pain that is lasting for weeks to months, because there is definitely a very good reason for somebody to be getting pain on a daily basis. If you do like this video, please click the like button, comment and subscribe for more such videos. Thank you.